Clean and clear, no nicks. Screws are good. I think we're ready to go to the Bahamas.
Cool.
My name's Bill Legard. I'm 59 years old. I live in DeLand, Florida. I've been fortunate to lead a very active lifestyle. I want to get up and go and make things happen. I enjoy flying airplanes, skiing, scuba diving, cycling, and that's a way I've chosen to live my life. Flying airplanes gives my wife and I freedom, the ability to see the world in a way that not everybody else gets to see it. And in order to support this adventure habit, I've recently started a parachute company with a friend. It allows me to combine my love of adventure with an actual business that helps support that. I first found out I had aortic stenosis by accident when I was being prepped for back surgery. I had no symptoms. Then last year I was in Bali and we climbed a 1,000-foot peak, and I found myself being very short of breath. My heart rate would go up to 125. I'd sit down, rest, drink water, and it took me 8 cycles of that to climb 1,000 feet. When I met with my cardiologist later, he said, "You're not just out of shape, those are symptoms of aortic stenosis, and it's now moved to severe. And you will need a valve replacement at some point in the future." That was hard to hear. I realized the things that could be affected by this situation. My family, my business, the fear was very real. But luckily, there was a solution.
At Bill's age of 59, we'd consider a mechanical heart valve, which will last longer, but to avoid a potential stroke, he'd have to take blood thinners or Coumadin and follow a very dedicated dosing schedule the rest of his life. Plus, blood thinners would put Bill at a significant risk of severe bleeding.
Blood thinners would mean completely relooking at how I live my life. If I were no longer able to pursue my passion, it would certainly impact my livelihood.
Tissue valves are a better choice for active people, but depending on the patient's age, they may not last as long with earlier valve deterioration, so I told him about the INSPIRIS RESILIA aortic valve. This valve is made with Resilia tissue. It's a bovine pericardial tissue with integrity preservation technology that actually blocks calcium buildup on the valve over time. The animal data on Resilia tissue is quite promising, and it could really make a difference for active patients. The INSPIRIS valve also has a feature called V-Fit technology.
And that was an easy, no-brainer decision. The surgery went pretty seamless, and now I'm 3 months out, and I feel fantastic.
Southerly course?
Yeah, let's go flying. I'm exercising regularly. I'm taking on tons of challenges, meeting new customers, and I feel great. Getting back to flying has been amazing. It's wonderful to be able, after the heart surgery and recovery, to get back in and have that freedom to go. But sometimes it's not enough, and I just gotta jump. If you're gonna jump, you better have a good parachute. And we make fantastic parachutes, and that's super rewarding. I could not even imagine what my life would be like on blood thinners. So I'm grateful for this amazing product and what INSPIRIS valve has done for me.